Knee pain, one of the most common for old age people or people who are in middle age like 30 to 50 years, but it can affect people at any age. Knee pain can be caused by an injury or any medical condition, such as for injury it can be ruptured ligament or torn cartilage, and for medical conditions, it can be caused by arthritis, degeneration of bones, iliotibial band syndrome, gout, Osgood-Schlatter disease, or infections. Now, after knowing what is knee pain and how it can be caused, we can finally get to its symptoms and how it affects people, as knee pain vary person to person depending upon the cause. There are many symptoms for knee pain, such as swelling, redness, stiffness, warmth to the touch, popping, crunching noises, inability to fully straighten the knee. Let's see what type of injuries can cause knee pain. First is ACL injury, anterior cruciate ligament. Second is fractures. Third, torn meniscus, knee bursitis, patellar tendonitis. For medical conditions like arthritis, there are many arthritis, but the most likely to affect knee pain are osteoarthritis, rheumatoid arthritis, gout, pseudo-gout, septic arthritis. Now, to prevent knee pain naturally, there are few things should do and you shouldn't. You should start exercising if you don't. Taking too much rest can make your muscles weak, hence you should not take rest for too long. If you're having too much trouble, then you should probably consider taking Chinese therapy acupuncture. If you are someone who has a minor injury and which lead you to knee pain, then taking rest and using ice packs can help you, as it reduces swelling and helps you minimize the pain. If you're having knee pain, you should never do the intense workout, as it may get the situation worse for you. Jumping, running, lunges and weight squats can also put so much stress on knees, which may lead in total dislocation of knee bone. When should you see a doctor for knee pain? The answer is so simple: if you are having the swelling, inability to bend, deformity, fever, unable to walk, or if the pain doesn't go for more than a week, then you should probably visit a doctor specialized in bones. Now we know almost everything about knee pain, but if you're having knee pain and can't visit a doctor, then there are few things you can try. Let's see how you can get rid of knee pain naturally. You can try RICE, that is, rest, ice, compression, elevation. You can start doing yoga if you are not. Yoga really helps you to concentrate on your body, mind and health. If you feel you're having knee pain because of overweight, then weight management and exercise can help you get rid of knee pain. You can try heat and cold therapy, where you're using a heating pad and gel-style ice pack. You can try massaging your knee using ortho oils, which are easily available in the market, though please consider asking your doctor first before applying any oil. If you like the video, please give us a thumbs up and share it with your friends. And please don't forget to hit the subscribe button and click the bell icon to get more updates on health benefits.